Yep. Back to school, first thing you think about is clothes.
Oh, yes. Yeah,
and
back to school. Supplies.
Schedules. But germs.
Ooh.
There's all those germs that you've missed.
Well, you know, on every list, it seems that there's hand sanitizer on every back-to-school supply list. Well, it's time now for many families to take their kids to the doctor for those immunizations and for advice to keep your kids healthy throughout the school year.
Alexis Arnold talking with a doctor at Genesee Pediatrics about what parents need to know this time of year. Hey, Alexis.
Hey guys, good morning. Yeah, many parents seeing forms like these. If you've already been to visit your local physician, your local doctor, it is that time. And this is one of the forms letting people know about the vaccines that their child might have received. But yeah, we're talking germs all morning, how to keep your kids healthy. We're here at Genesee Pediatrics as part of Rochester Regional Health. We're going to be talking with Dr. Collins. This is a busy time of the year for you guys. How would you describe it?
Yeah, this is what we refer to as checkup season. We're doing a lot of back-to-school physicals, making sure kids are up to date on their immunizations, doing sports physicals, and looking at, you know, any medications that they might need for the school year as well. So it's definitely a busy time. Yeah,
because in addition to getting those school supplies and clothes, as you guys mentioned, the kids have to have those immunizations in check and provided to the nurse's office so they know how to treat them if something comes up. Those vaccines in this big machine here, this big fridge, they call it Bertha. They are ready for those parents and students to come in. So we're talking vaccinations. Parents, what do you need? It can be overwhelming. So what are the big vaccinations that your children need before they head back to school? We're going to talk about that. We're going to talk about how to boost your kids' immune system and the flu shot. I know we got to think flu season already, but there are some important changes, and we're going to talk about that on Good Day Rochester on Fox Rochester.
All right. Thank you, Alexis.
Thanks, Alexis.
13 WHAM News, getting you ready for back to school. Prepping is about more than buying school supplies and new clothes. It's also about the health of your kids. Alexis is live at Genesee Pediatrics this morning learning about immunizations, what parents need to know. Alexis?
Yeah, so much. It can be very overwhelming, the checklist that you have to keep up with the mounting of illnesses that you want to keep at bay, right? Because you're going to be at school around a lot of kids. We're at Genesee Pediatrics as part of Rochester Regional Health. Dr. Collins, kind enough to let us in the door this morning. Thanks so much for being with us.
Thank you.
This is a busy year for you, you said. You said a lot of the vaccines are here, and you're already seeing parents come in the door and they're starting to get their kids ready for back to school.
Absolutely. This is kind of our back to school rush time. So we're doing a lot of, physicals to get kids ready for school, sports physicals, going over their immunization record, making sure they're all up to date on their shots.
Yeah. Speaking of immunizations, there are a lot. I mean, and we're talking babies too, because they need all of this done before they head off to daycare. What are the big vaccinations that parents need to get their children?
There's a couple of times that are really important. So one is at the start of school at kindergarten. There's a set of booster shots that kids are due for. Their measles, mumps, rubella, their chicken pox, and their tetanus and whooping cough vaccine. At 6th grade or 11 years old, there's another booster dose of the tetanus and whooping cough vaccine called the Tdap vaccine. And then there's a new law in New York State this year about the meningococcal conjugate vaccine, and that's due for 7th graders and for 12th graders. So that's the new one this year.
All right, we're going to recap that again after 7:30, and she also mentioned some new recommendations for the flu shot. Some good information for parents. You don't want to miss that. Stay with us on Good Day Rochester.
Back to school means kids back in close quarters in the classroom where kids are known to spread germs. Alexis Arnold live at Genesee Pediatrics, where local doctors explaining how to boost kids' immune systems and some new information about flu vaccines. Hey, Alexis.
Hey, we're going to recap the vaccines for you in a bit, but first, Dr. Collins joins us now, and, we're talking back to school, but hard to believe flu season is around the corner as well. So soon you'll start to get the doses of those vaccines in, but there's some changes that parents need to know about.
Yeah, there is a change this year. So this year there's not going to be any nasal flu vaccine. And the nasal flu vaccine, of course, in pediatrics is always very popular because there are no needles involved. But over the last couple of seasons, it hasn't worked very well. So this year, the Centers for Disease Control and the American Academy of Pediatrics are both recommending against its use. The flu shot is still recommended, though, and that's for all children, and that starts at age 6 months.
Yeah, and the nasal spray was so vital for many parents of kids who did not like getting shots, and now they're just going to have to suck it up up and get that shot, because you're saying, according to research, it was not effective.
Yeah, they're still looking into exactly why, so I'm sure there'll be more research to come on that, but the safest thing to do this year is to get the regular flu shot. So we're trying to get the word out there so parents are prepared and they can prepare their children for that this year. All right.
So it seems when you've got kids in a close quarters in the classroom, they're sharing whatever, utensils, it seems like they're little petri dishes of growth. But how can one boost a child's immune system so maybe they don't get sick as often?
Yeah, so there are a couple things that you can do. Probably the most important is hand washing. So you want to make sure your child knows how to wash their hands properly and that they do it frequently throughout the day. Hand sanitizer is good as well, although if a child's hands are visibly dirty, they should definitely be washing with soap and water.
Yeah, I was going to ask about the hand sanitizer because that is also on many school supply lists, and you're saying it is a good option, but hand washing is the best.
Yeah, I would say that's true. I think hand sanitizer is very convenient and easy, so children are likely to use it. So we certainly still recommend that. But again, if the child's hands are visibly dirty, you have to go with the soap and water.
Yeah. When washing your hands, how long should they wash for it to be effective and really getting a good scrub?
Yeah, so one trick that you can use with kids is to have them sing happy birthday in their head. And if they go through that twice, that's about the right length of time to wash their hands.
Oh, okay. You hear that, parents? Have your kids sing, maybe sing along with them so that they are really effectively washing their hands. Okay, so we're talking vaccines now. A lot of parents are coming into the office because either their child's going off to daycare or it's time, the nurse needs an update on a lot of the shots that they're given. So what is the big vaccination that parents need to know?
Yeah, so the new piece of information this year in terms of vaccines is about the meningococcal conjugate vaccine, and there's a new New York State law that's going into effect September 1st, and it's going to require students who are entering 7th grade to have had 1 dose of the vaccine, and students who are entering 12th grade to have had 2 doses of the vaccine. But the vaccine itself is not new. It's been part of our recommended immunization schedule for over 10 years now. It's usually given at 11 and 16 years old. So if your child's up to date on their well child care and their immunizations, they've probably already met that requirement.
Yeah, and so that's for older school-age children. What about the younger ones? What kinds of shots do they need to get this time of year?
Yeah, so the other big time is usually when kids are first starting school, so at that kindergarten time period. There's a set of booster shots that they get before they start school, and those include a tetanus and whooping cough vaccine called the DTaP vaccine, the measles, mumps, and rubella vaccine, also known as the MMR, and then the chickenpox vaccine or the varicella vaccine. And those are the 3 big ones that they need before they start school.
All right. And as we wrap up here, there is some controversy and some people have concerns about vaccines. Maybe questions, I should say, is a more appropriate term. What do you say to a parent who has concerns about giving their child vaccines for whatever reason? How do you ease those concerns and what questions do you want to address?
Well, I certainly talk about the research that's been done. These vaccines are well studied and they're ongoing. And so, we know their safety profiles. But I definitely encourage parents to talk with their pediatrician or their family physician with any questions that they have so they can really get them addressed individually.
All right. Good to know. Dr. Collins, thank you for your time this morning.